Is bad for many reasons, and nasopharyngeal cancer is one of them. Yes. Okay. And the other thing is, if you have a nasopharyngeal cancer family, in other words, if someone in your family has nasopharyngeal cancer, then you're at higher risk. And if you have symptoms like a stuffy nose or sinus congestion feeling or headache, it'd probably be a very good idea to get evaluated for nasopharyngeal cancer.
I see. Okay. And so once a person is diagnosed, or they go see their oncologist, such as yourself,
right.
What are some of the treatment options that they can look into?
So early cancers, which are not commonly found, we just use radiation. Radiation is like a strong X-ray. We give a little bit every day, and it kills the cancer tissue. Cancer cells are very sensitive to radiation, so that they die from radiation way before healthy tissues die.
I see.
So that's why it works. If you give too much radiation, then the healthy tissues die. So the radiation oncologist, who specializes in that, figures out a dose that's below, it's a safe dose for normal tissue, but high enough to kill the cancer cells.
And that's something that you specialize in.
I give chemotherapy.
I'm sorry, chemotherapy, you're right. You
That's
did
right.
mention
And we across the hall we have a radiation oncologist.
Ah, I see.
Dr.
Okay.
Coty.
And so what is the difference between the two? Radiation and chemo.
Right. So chemotherapy is used if the stage is more advanced. And chemotherapy goes in the bloodstream, and it really, just the definition of chemotherapy is medicine that kills cancer cells.
I see.
The problem with the chemotherapy is that it kills healthy cells as well. But the cancer cells, again, are much more susceptible. So cancer cells die a lot faster with chemotherapy, and we lower the dose so that it's harmful to the cancer cell, but it's not harmful to as harmful to healthy cells. And when in the stages that are advanced, we give both radiation and chemotherapy at the same time. So the cells are getting hit from chemotherapy going inside the cell and the radiation at the same time, and it has a lot of good cancer killing ability.
I see. And so I understand that you have treated someone with nasopharyngeal in the past. Yes. Can you give us an idea of what that treatment is like, as opposed to maybe some other type of cancer, like lung cancer or throat cancer or something like that?
It's very similar to throat cancer. It's actually a very difficult and rigorous treatment. There are a lot of side effects, but we do it because it has cure rates, that patients are cured. In the earlier stages, cure rates are very high. In the intermediate stages, they're good. They're not great, but they're good.
Yeah, it's something you showed here in this piece.
That's right.
Right, okay.
That's right. So even in a very advanced stage, in our highest stage, stage 4, we still have cure rates approaching 50%.
Oh, wow.
So therefore we treat patients with this very harsh, aggressive therapy. They do have burns in the throat and difficulty swallowing. The chemotherapy causes hair loss and some nausea and vomiting and that kind of thing. And we worry about all these systemic things and watch all the organs. And we see our patients very closely. Like the radiation doctor sees patients almost every day, and I see them every couple of weeks. So we follow patients very, very closely, because if we can get the patient through this intensive treatment, we have a chance of curing them. So we feel it's worth going through the torture, what feels like torture to our patients for the 4 to 6 months of getting all this therapy. Then they can be free of disease forever. And then we, of course, have to worry about the side effects that they might have for the rest of their lives.
So the benefits outweigh.
That's exactly right. Right. It's the treatment is hard. The quality of care during the treatment is low, but to be cured is very important.
Yeah. All right. Well, thank you very much for that wonderful explanation, Dr. Coty.
You're welcome. Come back anytime.
I will. Thank you for watching this episode of My Story. Before I close out the show, here are a list of great organizations here in Guam that work to assist patients diagnosed with cancer and their family members. A special thank you to Bob Camacho for sharing his story. Also, thanks to the American Cancer Society and Dr. Paul Coty. Until the next episode, eating right and living right is the best form of cancer prevention. From all of us here at My Story, adios. you.